Good afternoon. We are second-year students of the second group of the medical faculty at the Saratov State Medical University, Alena Volkhova and Darья Захarova. We would like to present our work, BOKERIA, Cardiac Surgery is a Life's Work.
We have chosen this exam for various reasons. My reason is the cardiology. I like this way in medicine for my development because I want to become a cardiologist. This is a very useful direction in medicine because mortality from diseases of cardiovascular system is on the second place. Developing on this direction, it is possible to change this ratio of death and give people the opportunity to live a full life. And in general, I am very interested in this direction.
When I found out about Dr. BOKERIA, I was struck by how an ordinary person can reach such height. In addition, his Bakulev Cardiovascular Center is the most high-tech and developed in Russia. Leon Anatolievich BOKERIA is a Soviet and Russian cardiosurgeon, innovator, organizer of medical science, professor.
The main direction of scientific activity of BOKERIA: arrhythmia surgery, surgery of coronary heart disease, congenital and acquired heart defects, terminal heart failure, hyperbaric oxygenation, minimally invasive heart surgery, the use of laser in heart surgery, use of computers in surgery, mathematical modeling of pathology of the cardiovascular system in experiment, target planning and methodology of science.
Pays great attention on the issues of protecting the professional safety of doctors, including doctors of risk specialties, neurosurgeon, cardiovascular surgeon, specialties in endovascular and abdominal surgery. The main task in the area is the need to create an effective system of legal regulation in healthcare. He is a member of Coordinating Council of the Center of Medical and Legal Support of Medical Workers and actively cooperates with specialists of the Association of Legal Education, the Association of Lawyers of Russia, the Association of Cardiovascular Surgeons, and Association Law in Healthcare and other communities.
Scientific achievements of BOKERIA. BOKERIA opens the country's first works of hyperbaric oxygenation. Hyperbaric oxygenation is a method of saturation of the patient with oxygen or oxygen therapy under high pressure for therapeutic purposes, carried out in hyperbaric pressure chambers. It is used in treatment of decompression sickness or air embolism. The therapeutic principle is associated with a significant increase in the partial pressure of oxygen in biological tissues in compressions with them achieved by breathing pure oxygen under normal atmospheric pressure.
The effect is manifested in an increase in the oxygen capacity of the blood. The original works were performed using hyperbaric oxygenation in intensive care, transplantology, and some other sections. He personally performed almost 200 persons on the heart under high pressure in the baroperative. A number of the operations on the dry heart, as well as with a combination of hyperbaric oxygenation and artificial circulation, were the first in the surgical practice.
BOKERIA's great merit in the development, together with physicists, the first operations and the introduction into practice of transmyocardial myocardial revascularization using a domestic carbon dioxide laser, and subsequently an excimer laser in the most severe contingent of patients with coronary artery disease, with distal coronary artery disease, when it is impossible to perform aortocoronary bypass surgery. In this step, in this nervous problem was the intraoperative use of TMLR in aortocoronary bypass surgery.
made a great contribution to the problem of coronary heart disease. It's a disease caused by a mismatch between the need of the heart muscles for oxygen and its delivery, leading to cardiac dysfunction. He introduced into clinical practice new method of left ventricular reconstruction in patients with post-infarction heart aneurysm. Aneurysm of the heart is the limit protrusion of 10 seconds of the heart wall.
He is the initiator and pioneer of minimally invasive heart surgery, including the use of three-dimensional mapping of the surgical field to improve the safety of the operation itself.
A special merit of BOKERIA is the performance of the first operation in the USSR of fully implantable artificial ventricles of the heart, in particular the IHS Novakov.
He is the pioneer of fundamentally new section of cardiac surgery, minimally invasive heart surgery in the USSR. He performed the first successful operations using the latest methods in patients with congenital and acquired heart defects, with life-threatening arrhythmias, with coronary artery disease.
Has more than 150 patents of inventions, utility models, and innovation proposals. He is the editor-in-chief of scientific and practical journals, Annals of the Arrhythmology, Creative Cardiology, Bulletin of Lymphology, Clinical Physiology of Blood Circulation, Children's Heart and Vascular Disease, Thorax and Cardiovascular Surgery. Since 1994, he has been the head of the Bakulev National Medical Research Center of Cardiovascular Surgery.
Thank you for your attention.